Hello everyone, I'm Rod. I'm from the Philippines, but currently here in National Cheng Kung University in Taiwan, pursuing my graduate studies in nursing. Thank you so much, Virology Education, for this opportunity to present our research on a cross-sectional online survey on HIV and STI-related knowledge, tendencies toward stigma, and willingness to HIV and STI screening among allied health students of Iloilo province, which is located at the central part of the Philippines. Now, to start, it is important to acknowledge that stigma and discrimination remain as a formidable barriers of HIV care globally. Now, in the Philippines, we have been doing a lot of stigma reduction programs for healthcare professionals in order to avoid and reduce the preconceived knowledge or notion regarding people living with HIV and those who were having sexually transmitted infections. However, these stigma reduction programs are only introduced thoroughly and deeply right after we graduated from our courses or we start having our clinical duties in sexual health facilities. Now, this is the fact that inspired us in pursuing our study so that we can explore the interrelationship of the knowledge of allied health students in the undergraduate program in their tendencies to stigmatize people living with HIV or those who have sexually transmitted infections and their willingness to undergo HIV and STI screening. And this focused on Iloilo City. This is a cross-sectional online survey, as I have mentioned a while ago, and this was distributed in different social media platforms between February 7 to 24, 2021. Now, the questionnaire revolved around four different aspects. First, of course, there is the social demographic data. Second will be or should I say, second was the HIV and STI related knowledge, and these were measured with a 10-item dichotomous questionnaire that is answerable by true or false. Now, the result was tallied, and those who got a score of 8 out of 10 or higher were categorized as high level of HIV knowledge, while those who got below 7 or 7 and lower were categorized as low level HIV knowledge. The third part was the stigmatizing tendencies, and this was determined by the 5-point Likert scale. And lastly, the willingness to get tested and access to HIV services were gathered during using a binary response. And finally, the results were analyzed using descriptive statistics, chi-square, and regression analysis. For the social demographic profile of the students, majority of the allied health students were youth aging 18 to 24 years old, which is congruent to the overall campaign of HIV awareness and STI prevention programs in the country that is targeted towards youth as part of the key affected population. Now, more than half were from Iloilo Doctors College. This is the school where I am affiliated as a faculty member. And majority, or should I say more than half as well, were belonging to the third year level, which is a year before they graduate or 2 years before they graduate. For the allied health courses, among the allied health courses, nursing degree had the highest response rate with 32.65% proportion among those who answered the online survey. In terms of the overall access to HIV and STI health services, there were 57% who reported to not have accessible HIV and STI testing facilities in their locality, while 51% reported not having affordable HIV and STI testing services, while only 31% were willing to get HIV tests regularly. Approximately 62% among the students got a high rating, which is, as I mentioned a while ago, 8 out of 10 or higher in the 10-item HIV and STI concepts-based questionnaire. However, around half of the students answered the question on undetectable equals untransmissible incorrectly. Um, it has been a campaign that we have been doing in the civil society and community based organizations worldwide. But then the academic side of allied health um, students are still somehow unaware of this particular campaign. That's why it's important to focus on this if ever we introduce the curriculum. Now, in addition to that, 49% believed that HIV was transmitted through food, and around one fourth thought that HIV and STIs were acquired in public toilets. These two particular domains or questions is alarming, knowing that this could lead to misinformation and also false idea towards HIV transmission. And this needs to be corrected by HIV and STI focused curriculum. The tendency towards HIV and STI related stigma was indexed at 36%. Majority, or should I say, a lot of allied health students agreed to the following statements in a 5-point Likert scale. 77% said that there should be a specialized hospital policy in caring for people living with HIV or those who have HIV and STIs. Wearing excessive protective tools or equipment and caring for patients were agreed by 59% of the respondents, while 53% were worried of getting HIV and STIs while providing care for their patients, and almost half, or 49%, believed and agreed that people with HIV should not have sex anymore. In the cross tabulation, there was a statistically significant association between the educational institution where you are enrolled, where the allied health students were enrolled, and the experience of caring for people with HIV and STIs, the knowledge on HIV and STI, and the HIV status or accessing HIV test. Now, overall, allied health students of Iloilo Doctors College were 1.74 times more likely to have lower HIV and STI knowledge than those from other schools. As a response, I already talked to the administrative department and the office of the vice president for academic affairs and the research department of our school to discuss the possibility of introducing HIV and STI curriculum in our college. This is greatly inspired by one of the courses that is given here in National Cheng Kung University. In our postgraduate program, we have HIV in the context of public health, which is taught by an amazing professor, Professor Monica Ko from NCKU, Department of Nursing. And I was inspired by that particular idea, and that is the reason why I'm also trying to introduce this kind of course in our school. Now, in addition, allied health students with experience in caring for PLHIV and STIs were 3 times more likely to have a higher level of HIV knowledge. Now, this may suggest that we should start our clinical experience or handling of people living with HIV or STIs at an early year of our BSN or allied health curriculum. However, we need to go around the issues on confidentiality first and also the legalities of this particular idea. We also need to acknowledge that sampling biases and social desirability biases may also have affected the results of the study. That's why it may not be generalizable yet, and we suggest to do further investigation on this particular concept. Nonetheless, there is a need to include HIV and STI related curriculum among allied health profession, highlighting the importance of stigma reduction through evidence-based HIV and STI education. And with this, let me just say thank you to the 389 allied health students in Iloilo for answering the online survey. Your voice was greatly heard, and Because of that, we will be able to push for a curriculum that focuses on sexual health, particularly on HIV and STI. And once again, I am Rod Olete, and I am from Iloilo Doctors College, College of Nursing, and also a student of National Cheng Kung University in Taiwan, saying thank you so much for listening. I'm excited to hear your questions right after this presentation. Thank you.